you're at all these events, and how do you deal with it? How do you take notice that there is a concussion on the field? How do you deal with it? I'll throw it out to you, Bill, first.
Well, by watching what's going on in the field, first of all, and again, our coaches and administrators that are there are one of your first lines of noticing things. They notice if a big hit occurs, or if the student is acting differently. If and the coach makes us aware of it. If we're not on site at the time, they make us aware as we go through a field evaluation, and we use what's called a SCAT-2, is a sideline assessment test, and we check on signs, symptoms, what they're feeling, and how they're acting. Knowing our student athletes is so important, because you know how they act and you know how they do things when they're on the field. And if they're not acting right, and this is where PJ shaking his head, you coaches see it all the time. Boy, he's just not doing what he's supposed to do. He's not acting like the player I know. And they make us aware of it. We assess them. We send them on from there. Any of the signs and symptoms that Dr. Franks described earlier, we take the person off the field. And it's just, again, we're being more precautious than we ever been, and it's not worth risking a second hit or a second injury.
PJ, it's got to be difficult. You're in one of the sports that are most prone to probably concussions. How difficult is it? I mean, they don't always come over to you and tell you the information right away, I'm sure, so you have to be a little intuitive about it and kind of read some of the signs and see how they're acting, like Bill said.
Yeah, I think the key for us is nonverbal. Just a look, a daze in their eyes, not making eye contact, balance you had mentioned earlier. Those are things that we'll see directly right away in the huddle as we're in the practice field, or if it is a game, we'll be able to see just a little bit different movement from them in their nonverbal. There's no such thing anymore as getting your bell rung. And Dr. Franks had talked about when he had played, that was probably a term that everybody had used back then. I got my bell rung. Well, if somebody gets their bell rung now, they're out. And the one thing we do encourage is our kids not to risk it. Don't lie. Don't tell us that you don't have a headache, or don't tell us you didn't get your bell rung. Just tell us straight up, it's best for you, it's best for us. That's been key.
So the order of events that would happen here is, PJ, you would kind of identify it probably in most cases, and then send them over to Bill, or Bill, you might see it, or I guess it all depends on the situation.
Exactly. Usually
Okay.
It is some type of contact, or a lot of times, we'll see it, not a lot, but some maybe a wide receiver, somebody who's airborne, and they even hit the ground. And sometimes, like Dr. Frank said, it's maybe a chest contact or a back contact, but it's almost a whiplash effect of going up to the head, and we'll see some of that. I think last year, from freshman to varsity level football at Cherokee, we had 8 concussions. And Jeff Wood is outstanding, and I think we had averaged 15 days before we got that athlete back on the field. I think we probably tend to err on the side of caution, which is best.
Okay. So Brad, you're at a lot of these events, obviously. So where do you fit into this process in identifying? They identify it, and you're made aware of it, I'm sure. What do you do with the information?
Yeah, we're usually made aware of it. Obviously, we're at the field, we're at the sites, and if we're made aware by coaches, if they can't get to an athletic trainer, we'll assist in that. Locating our athletic trainer so that they can observe them and go through all the tests that they do for the athletes to decide whether or not, or how badly their concussion may be.